All right. Hello, everybody, and welcome to our panel tonight titled COVID-19 Response International Collaboration. I am Dr. Christine Crudo Blackburn, the Deputy Director of the Pandemic and Biosecurity Policy Program at the Scowcroft Institute for International Affairs in the Bush School of Government and Public Service. And tonight we have two amazing panelists with us, Dr. Keiji Fukuda and Olga Jonas. So I'm going to start tonight by giving you a little bit of background on myself and on our speakers, and then each of them will give a short presentation. And the presentation will be followed by a Q&A section. The first part of that Q&A will be moderator questions and pre-submitted questions. So some of you who you submit pre-submitted questions when you registered for the event. So we're going to do a couple of those. And then the last, 10 to 15 minutes of the event, we're going to open up to live audience questions. So if you have questions, please share those questions in the chat, and I will go through them when we get to that section of the panel, and I will ask those questions to the panelists. As I said, I'm Christine Crudo Blackburn. I will serve as your moderator this evening. I have an interdisciplinary PhD in political science, communication, and veterinary clinical sciences from Washington State University. The focus of my work is mostly pandemic preparedness and response, but I also work on issues of health access for marginalized populations, as well as neglected tropical disease. And so I will give you a quick overview of our speakers, and then I'm going to just turn it over to them to take it from here. So Keiji Fukuda is Director and Clinical Professor at the University of Hong Kong School of Public Health. He was previously Assistant Director General for Health Security, a special advisor to the Director General for Pandemic Influenza and for Antimicrobial Resistance, and was Director of the Influenza Program at the World Health Organization in Geneva. Before that, he worked at the U.S. Centers for Disease Control and Prevention as the epidemiology section chief in the influenza branch. Professor Fukuda has been a global public health leader in many areas, including health security, and personally has led numerous field investigations, global responses, and diplomatic negotiations related to emerging infectious diseases, including seasonal avian and pandemic influenza, SARS, MERS, Ebola, and antimicrobial resistance. At WHO, he oversaw implementation of the international health regulations and the pandemic influenza preparedness framework. And he is an advisor to the Hong Kong government for COVID-19. So really excited that he is here to talk to us today. Our other speaker is Olga Jonas. Olga Jonas is a senior fellow at the Harvard Global Health Institute after serving for 33 years as an economist at the World Bank. She coordinated the World Bank's operational responses to avian flu and pandemics in 2005 to 2013. The Indian Ocean tsunami, the small states and implementation of revised emergency response program. And until 1994, she worked as a macro economist for policy reform programs, and then as a policy advisor for two replenishments of IDA, which is the World Bank's funds to the poorest countries. She now focuses on pandemic and epidemic risks through understanding the links to economic development, policies, policies to contain antimicrobial resistance, and the role of One Health approaches. So we have two really wonderful speakers tonight that are going to talk to us about the importance of international collaboration and some of their experience in pandemic preparedness and response. So Dr. Fukuda, the floor is yours.
Thanks, Christy. Actually, can you hear me? Okay, wonderful. So first, everybody, I'm genuinely excited and very delighted to join everybody here, and particularly to do this with my old friend and colleague, Olga. And I want to first thank, however, Professor Natsios and Christy for the invitation to participate in this event. So what I want to do is first go over a couple of slides. I have about 13 slides to try to provide an overview of how I looked at things, or how my perspective on these sorts of issues have developed over the last number of years. So the first thing, Christy, is am I sharing this right? I'm terrible on this kind of.
No problem. I think you have to do the presentation mode on your screen for your PowerPoint.
Let me see. Can you see it now?
Can, yes.
Okay, great. So anyways, thanks everybody. I want to just give you a quick kind of overview about how I see the issues related to pandemic preparedness and the challenges that we face and some of the multilateral aspects. But I think it's evident from what we're all going through that the impact of COVID-19 has been profound and in a variety of different ways, having to do with how we live our daily lives, our business practices, issues related to travel and border controls. I think it's also clear that COVID has been an unprecedented amplifier of a number of things, but I just want to highlight one of the things which it has really done is amplify the sort of cultural and national and global tendencies and also vulnerabilities. The key issue looking forward is that it does have a number of implications, and I think that in the post-COVID period, we're all wondering what are the societal norms going to settle out as. But a couple of other things I want to point out is that I think there are real issues of realignment which are going to become increasingly prominent. And to be blunt, one of the discussions in Asia increasingly is, why does Asia emulate the West? And this has been something which has surprised me, but these discussions have to do with, in the past, much of how Asia has thought about things related to pandemics and so on has been based on the thinking in North America and in Europe. Another issue which has come up for a lot of discussion is whether we are going to continue to be able to have multilateral responses, or are we going to evolve more into a go-it-alone philosophy? And I think the importance of this is that we have big challenges already here, and then others which are going to come in the future. So we can expect additional pandemics to come in the future. But of course, in the back of our minds, we're always thinking about issues such as climate and global warming and so on. So to go to the bottom line, the point I want to make is that it is very clear that we're going to need to both deepen and broaden our approaches to preparedness, or when we face both the other challenges now and also future challenges coming up, including pandemics, we're really going to struggle. So as Christy mentioned, I've been working in this area for quite a long time, and this is really over about a 40-year time span. And so the thoughts that I'm going to be presenting to you are not something which come out just from COVID, but really from about 3 or 4 decades of working on these kinds of issues from a variety of different perspectives. This includes my medicine training when I was in San Francisco taking care of AIDS patients in the early 80s, through things like being in many countries on field investigations, working both extensively in the US, but also with a number of countries on preparedness, working through WHO on a number of country missions related to health security related issues. So this may be the emergence of diseases, or it may be having to do with capacities or implementation of the IHR. In 2009, when we went through our last pandemic, which was the H1N1 influenza pandemic, I was the lead in Geneva on that issue. And then resulting from these sorts of health security issues have been a number of diplomatic negotiations. These include the international health regulations, pandemic influenza preparedness framework, antimicrobial resistance, and so on. So finally, in a certain sense, I've almost come full circle. I'm now based in Hong Kong, working at the University of Hong Kong School of Public Health. And in the position of being here, I'm both a direct participant to COVID in Hong Kong, but also, as Christy mentioned, advising the Hong Kong government as one of a panel of scientific advisors. Now, one point is that there are certain patterns which characterize most outbreaks or most large outbreaks. Invariably, no matter how well prepared we think we are, we're always surprised. There is a great deal of anxiety and attention in the beginning. And then after that is over, or after we get through that initial phase, of course, countries and locations begin to respond. And these responses vary widely from being dysfunctional to highly functional. But the point I want to make here is a highly functional response means that a location is able to adapt, and we'll come to what that means. But the other part, for those who have worked in this field for a long time, which is a bit distressing, is that these outbreaks, even the largest, like the 1918 pandemic in the last century, have a bad tendency of simply disappearing from public and political memory. The professionals may remember, but they generally disappear from public memory. There are a couple of notable exceptions. One of them is HIV, AIDS, which I think has in an unusual way really become woven into society. So that has truly changed how we see things and how our expectations of both the medical care, but also things such as sharing and ethics and so on. And then SARS, particularly in Asia, and I'll come back to the impact of SARS in Asia. So when we look at smaller events, and by small events, you see the examples that I'm talking about, the emergence of avian influenza H5N1 in Hong Kong, the emergence of MERS, which occurred in Saudi Arabia, but then one of the largest outbreaks occurred in Korea. With these smaller events, what I really see as the distinguishing element between managing these outbreaks well and poorly has to do with pre-existing systems. It does not have to do with planning, but really the strength of pre-existing systems. And by that, I mean the system of governance, communications and information sharing, the health systems, how well people can be taken care of, and finances, whether there is simply a functional system to fund the activities which need to get done. And so in terms of the governance, of course, there's a wide latitude in terms of what kinds of governance we may have. In the world right now, we range from democratic governments up to highly authoritarian governments. But the question here, at least in terms of events, is how functional they are. And the reason why I consider H5N1 and MERS and Seoul both to be good examples of well-managed events is that what they're able to do is that after the viruses emerged in those locations, to adjust and make the adaptations needed to deal with the situation. But almost equally as important, these locations have also taken opportunities to strengthen themselves. And so, for example, during H5N1 or following H5N1 and SARS, one of the things which has occurred in Hong Kong is the development of emergency operating centers, the increase in the number of beds for taking care of sick patients, and so on. And so there have been a number of adaptations. In Korea, we've seen the same kinds of changes, where things such as the Korean CDC has greatly been strengthened, and a number of vulnerabilities in their health system have been identified and adjusted. But when we come to larger and more severe events, and again, by that, the examples that I'm pointing out are things like COVID, or the very large Ebola outbreak in West Africa, or the 2009 H1N1 pandemic, I think the situation becomes considerably more complex. And what I have begun to see over decades is that when the events are small, we can think of them somewhat as epidemiological and scientific phenomenon. When they become larger, they become increasingly societal in dimension. And this makes it much, much more complicated. So some of the things that we see is that we shift decision-making from high technical levels up to political levels. And so I think when you think about COVID, you think of heads of states talking about their country and really representing their countries. And this is not something which typically occurs with outbreaks. The other thing that we see is that all countries, no matter whether the situation is a small outbreak or a pandemic, struggle between balancing national and international priorities and considerations. And so this sort of balance affects the narrative which comes out of countries. It affects things such as border controls and the permissiveness of travel. It covers things such as the dissemination of information, sharing of vaccines and other supplies, and other forms of assistance. And it also has a lot to do with the atmosphere and ambience of fear and hostility. All of these things are complex phenomena which shift in these larger events. Now, what's really evident with COVID is that one of the critically missing elements has been an emphasis on multilateralism. And let me give you two examples to highlight what I mean. Again, not so long ago, we went through a global pandemic of influenza. And so in 2009, we had the emergence of the H1N1 virus, which took place in North America, probably Mexico or the US, or somewhere in that region. Now, with that pandemic, at the start of that pandemic, what became very evident was the value of a couple of stabilizing elements internationally. These are the international health regulations, which are a binding agreement for all of the countries, virtually every country in the world which has signed on to them, and then the World Health Organization. And they were stabilizing in the sense that they provided coordination, and they were the vehicles for opening access to information, and then material support such as the distribution of antiviral medicines and vaccines, and especially in terms of low and middle income countries. I think that when I look back to that pandemic, there was a notable lack of finger pointing compared to now. There were some very difficult negotiations. In terms of vaccines, there were countries that had vaccines, and asking them to provide some of them or to share some of them was a difficult negotiation. And in terms of negotiating with the countries to receive them, issues of liability and whether the countries had the infrastructure to receive them were also negotiations that took place. So they were not easy, but they were functional, and that everyone was looking for a solution. If we come forward to COVID-19, by contrast, we're in a situation where the hostilities between China and US are fairly open. And we are beginning to see a number of things such as competing narratives. And the competing narratives themselves create confusion and uncertainties. They have led to reduced cooperation. And I think that in many respects, cooperation and relations are the key to normalizing. And so the degree to which we have antagonisms, the more slowly we normalize relations. A second thing that we have seen is that the international anchors for multilateralism, again, things such as the international health regulations, and organizations like WHO and CDC, in various ways have been diminished. You hardly hear mention of the international health regulations, and much of the mention of WHO and CDC has often been very critical. And so this has left us with large future uncertainties. How are we going to reestablish trust? Are we going to move towards cooperation, or more to a situation where countries, everyone is sort of forced to choose sides? So Hong Kong, like every place in the world, has also had to grapple with COVID. And I just want to point out an example of what I think is a quite functional response and why I think it's been effective. So in Hong Kong, the first cases began to appear in January of this year. And then you can see that there have been two relatively significant peaks, but for the intervening period, including right now, the number of cases is small. And by small, I mean ranging in the single digits in a city of about 7.3 million people. That first outbreak largely had to do with people who were residents of Hong Kong wanting to return to Hong Kong and bringing in infection from a number of different countries. The second larger peak had to do with the fact that there were a number of people who were entering into Hong Kong who were not being tested, and that initiated several chains of transmission in Hong Kong, which led to extensive transmission within Hong Kong. That also has now been brought under or control. The interesting thing about Hong Kong is that the occurrence of COVID took place against a period of very severe social unrest. So for those of you that follow Hong Kong, what you will know is that in 2019, for example, there were very large demonstrations, and this has to do with the relations between Hong Kong and the mainland. Nonetheless, given the size of these kinds of demonstrations and the very deep divisions with society, which I can attest to personally, the response by Hong Kong was very functional. From within the first days of the initial cases being reported in Wuhan, there was early attention, both by the government, by media, and by the public. And the response to the situation in Wuhan started very early. The government really was able to identify and begin to enact effective measures, prevention measures, pretty early. So these had to do with things such as border controls. So there was, it became more restrictive for travelers from mainland China early on. There were several social distancing measures which are implemented having to do with schools, with gatherings, and so on. And then mask use, which was already very high during previous outbreaks, became very, very high during COVID. This was also augmented by the fact that given its capacities, there's a very strong public health operational response. And so things like testing, even though the testing capacity was relatively small at the beginning, was increased in scope. Issues or activities such as contact tracing and quarantine, again, created a fair number of operational difficulties. Nonetheless, they were overcome. And then perhaps the key factor or the enabling factor was that the public was cooperative. Even though it was, many people were not happy with the government based on other issues, in terms of COVID-19, there was strong public cooperation. So if you ask the basic question, why could Hong Kong respond effectively? The things that I would point out is that it had, before COVID occurred, strong structural capacities. The system of governance is well established. Following SARS and H5N1, the health system and the emergency control systems were significantly strengthened. And this meant that the government had internalized lessons from H5N1. Hong Kong has the luxury of being financially pretty well off, and so those systems were immediately brought to bear. And then I know from my role as an advisor to the government that the strategy which was adopted early on was fairly realistic and adaptive, recognizing that what you do at one point in time may have to shift at another point in time. But the thing which, in looking at how other countries have responded, including my country, the US, these enabling factors have been extremely important. And so one of the critical balances in dealing with emergencies is what is the balance point between individual rights and societal priorities. This is very difficult for many places to balance. That's no less true in Asia, where both are prized, but I think that in a place like Hong Kong, it was very quickly, it was easy to move over towards the perspective where societal priorities are really important for people to acknowledge. I think this reflects, the enablers also were included the fact that people had internalized the impact of SARS. And in Hong Kong, a large number of people got infected and a significant number of people died. So some thousands of people got infected, about 300 plus people died. And this still is remembered very clearly by the public in Hong Kong. The other enabler is that, unlike in many parts of the world, the respect for science in Hong Kong and in Asia in general remains very high. Now, at the leadership level, the other points I think that were very important is that there was clarity on the differences between some critical aspects. When you're dealing with an outbreak or dealing with an emerging infectious disease, you need to understand what are basically scientific principles. And in terms of scientific principles, one of the basic ones is that if you're going to reduce or you're going to effectively address an outbreak, you need to make it harder for the virus to go from one person to another. So whether we're talking about border controls or testing or social distancing or masking, all of it is an attempt to apply that principle of making it harder for the virus to move. A second point, which was critical in terms of being clear on, were what were the governmental priorities. And here from the get-go, it was public safety. It was, even though the concerns about the financial and economic and business health of Hong Kong were always there, it was very clear that the priority for Hong Kong was public safety. And then it became clear that the third parameter was choices. And so given you have a number of different measures, you can do contact tracing electronically, you can do it using a lot of people and older methods, you can do surveillance in a number of different ways. You have choices on what measures you're going to apply. And here, I think that many of the questions that I would get from media would often have to do with, is method X better than method Y? And in a lot of ways, these were not really so useful questions. There are a lot of choices in terms of what measures you can use and the degree to which you can implement them. But you have to be clear that those are choices and that they are different than priorities and principles. So let me close down. I just wanted to put a couple of ideas out there. But the first one is that I think it's very clear that we have to think of pandemics as societal events within a global geopolitical context. When we talk about pandemics, we frequently are talking about them in terms of their epidemiological and scientific aspects, the emergence and spread of an unknown virus and so on. But really, at the heart of it, in a larger, perhaps more important way, these are very much societal events. The second point I want to make is that in terms of domestic preparedness, the concept of preparedness really needs to broaden from being technical to becoming societal. So traditionally, pandemic preparedness, both in the United States and worldwide, really escalated after the emergence of H5N1 in Hong Kong in 1997, and then after SARS again. And the traditional emphasis on that process has been on technical operations. And so a lot of discussion about surveillance, about stockpiling, about operational containment of the pandemic and so on. I see these discussions as useful, and I think they're important because we do have to be thinking about the operations, but they're really hugely insufficient in terms of the overall level of preparedness. In many respects, our greatest vulnerabilities are cultural and society in nature. And so to highlight what I mean by that is that if we simply look at some of the prevailing issues right now, we can ask these questions. Why do so many people in the US believe that COVID-19 is fake? Why is science becoming so distrusted by many people? Why is wearing a mask interpreted as a political act? And then I think a very important operational issue is, can media and social media become bridges for understanding rather than sources of division? It's not so clear. So finally, in terms of multilateralism, I think I want to close with this point. The lack of multilateralism really places the world at greater peril. And let me put this in perspective. I was once in a meeting in Geneva, walking out with a diplomat from another country. And that diplomat said, you know, we have lost the ability to really talk and negotiate rationally in most other fora in the world. This has to do with trade. This has to do with security issues. This has to do with human rights. He said health is the one arena in the world where countries can still talk and act cooperatively. And he said, if you lose that, he was not someone who regularly visited WHO, but he said, if you lose that, we are really lost. So I see that this multilateral approach is really critically dependent on anchors. And so as I pointed out some of them, there are frameworks, which really are a manifestation of attitudes. They are imbued in organizations such as WHO and CDC, and they are the vehicle for both reducing hostilities and antagonisms, which can arise during any emergency situation, and the basis for cooperation. So we need some very practical priorities to restore multilateralism in the health world. One of them is that it is really incumbent for the US to rejoin WHO soon and restore its strong support. The US has traditionally been one of the strongest pillars for WHO, and it needs to get back to that position soon. The US also needs to support restoring WHO's anchoring role. WHO has been severely criticized, and I think in some way its presence has been diminished, but it is absolutely essential. And I know that, again, from operating both in the United States, but also in Geneva. And then finally, we need agreements. We do need frameworks, and these are very difficult to negotiate. But the most important one we have in the world right now is the international health regulations, but it is not the only one. We also have other frameworks, such as the pandemic influenza preparedness framework. And I think that these are going to have to be updated. This is going to require negotiations, which many do not look forward to, but I do think that it's critical. So Christy, let me stop there. Thank you.
Okay, thank you so much. And we also got some questions submitted that I'll save till the end, so that'll be great. And Olga, I'd like to turn it over to you if you are ready.
Okay, sorry. And okay, so can you see the screen?
Yes, we can see the screen.
Oh, great. Okay, so my presentation is completely uncoordinated with Keiji, but I think it's highly complementary, and I'm really glad he covered the complexities of responses. My presentation is more about what we do between the crises And why is it that we are always surprised? We are always not prepared. And the costs, both human and economic, are always much larger than if we had been prepared. And I don't have 40 years of experience like Keiji, but I've been doing this for about 15 years. So there's about 15 years from H5N1, H1N1, and then the Ebola in West Africa response is kind of practical experience. So I think at the heart of our sort of predicament is that there are pandemic myths, which are false beliefs, and Keiji alluded to this too. And this is especially common among non-health sector people or among economists and policymakers in general, is that pandemics are inevitable and not worth worrying about because whatever happens happens, and so we can't do anything. And then other even more pernicious misconception is that the health sector is managing the risks, and it is not managing the risks. I mean, we are underinvesting in all the systems that Keiji already mentioned as being critical for good responses, and this is in countries and regionally and globally. So these myths lead to the situation that we don't estimate pandemic risk correctly, and it's grossly underestimated. Basically, we don't believe in that they can do so much damage, and the international system has been working accordingly. It's sometimes called neglect. Between crises, there's neglect of preparedness, of prevention, and because especially in the health sector, attention easily shifts elsewhere. So what we have now is the COVID crisis, which these are the latest IMF projections of the economic impact, and it's the worst event since the Great Depression. Economic output is going to fall globally by 4.4% in this year, when the World Bank came out with an estimate of 4.6% in 2008 of the impact of a pandemic. We were dismissed as being exaggerating and completely, out to lunch, and it was completely ignored. And so when you add up the costs across the world, you have $6 trillion just in 2020. That's already estimated very conservatively by the IMF. So hopefully this makes people aware that pandemic risk is really large, and it's not something that should be ignored the way it has been. Okay, it's an economic issue, and it's also a security issue, and it has not been treated as either of those. So the pandemic risk, when you sort of add up and multiply all the probabilities, and is about $80 billion per year. What this means is that we should be collectively investing as much as $80 billion per year to reduce this risk. I mean, this is rational. This is what you would do with your, household finances. If you are facing such expected losses that are every year, it's not just when the pandemic happens. It's sort of accrual idea. Then you should be taking measures to mitigate this risk. And our institutions, the World Bank, the IMF, the other multilateral development banks have been completely ignoring this. If you look through the assessments of risks to economies of different countries, never has there been a mention of epidemics and pandemics. Although clearly when the event happens, it's catastrophic, and it should have been anticipated, but it was not. But we know enough about these viruses, how they come back again and again, and they emerge at the interface with animals. Yet the policy making setup is not equipped to mitigate the risk. So, this crisis, which is really a major event, is an opportunity to put in place some rules that will help us avoid this kind of dire predicament in the future. I mean, this is a reasonable proposition. So first you have to look at the myths. And the plausible myth is that the health authorities are on top of it and in charge, and they will protect us from pandemics. And Keiji already alluded to this, that this is the technical solution is by far not enough. It's a societal event, and it's also an economic event, so it costs a lot of money. So the problem is that pandemic risk reduction is not a priority for the health sector. This has to be recognized. I mean, this is clear from how much has been invested in pandemic risk reduction in the past, very, very little. And that's because the prioritization in the health sector is, clearly favors existing and as opposed to potential patients. And as a result, we have this chronic neglect and sidelining of preparedness and prevention of these epidemic outbreak disasters. And it also requires measures in all sectors and not just health interventions. And it's very much dependent on communications and, so another myth is that nothing can be done, but, we know that human activity helps or hinders the onset of contagion, that 75% of pandemic potential pathogens are zoonotic, and wildlife and livestock health matter an awful lot, but our systems do not reflect this fact. So what is needed is a robust veterinary and human public health systems in countries, regionally, and globally. And we do not have this. And the science, there's no dispute about the science, what you need to have, the surveillance and the diagnostics and the analytics to, intervene effectively in an outbreak situation. But most places don't have this capacity, as we saw, not even in the United States. So this is a pitch for One Health approaches. They are necessary, and they are. And what's interesting about the COVID-19 emergency is that the macroeconomic risks are evident, right? You have a huge global recession that has been triggered by this virus, and we constantly hear new estimates about 100 million people falling back into poverty and development being set back by a decade or more. So it's clearly a threat to economic development. And we already have institutions that deal with macroeconomic risks and stability and with economic development, and they should be working on this more. And another point I want to make is that what's needed are not new funds or initiatives, but permanent capacities for long-term persistent threats, because we know that these outbreaks and epidemics will come again and again, and it's not something that's going to end after some 5-year initiative. And what is shocking in this area is how little it costs to invest in these core public health systems. And there's actually a term, they are called core systems, but they are forgotten by everybody in the health sector, it seems, or by many people who allocate the financing. And they would cost less than 1% of public spending on health. I mean, the World Bank estimated that it would cost $3.4 billion a year to invest and maintain core public health systems in all 139 developing countries. And the spending on health that's financed by government sources is 373 billion a year. So overall, it's just 1%. So it's not a question of lack of money. It's a question of wrong priorities, unfortunately. So despite the rationale for having public health systems, that they can reduce the pandemic risk, which is extraordinarily high economic rates of return, and prevents a global economic crisis or helps mitigate it or reduce the probability, there are very great difficulties in investing in these systems. One is the myths that I mentioned, that people don't believe in this, and they think that the health sector is going to take care of it. Then within the health sector, there is a medical bias and vested interest in healthcare as opposed to prevention or health. It's difficult to work across the animal-human interface and environmental and regionally global cooperation. And this is where you come to the importance of institutions, where that Keiji already mentioned, that if you have the multilateral institutions, they can be sort of a mediator among countries and among sectors, but they have to be tasked with this, and they have to be monitored that they are actually doing this job, because what has happened in the past during these so-called neglect periods is that activity has stopped, investments in these systems have stopped, and so what we are looking at is that we have we should have permanent systems to defend against the contagions and microbial threats, and they are financed by emergency funds. They are, it's just spurts of panic and that brings some money and everybody leaps at it. So the worst sort of belief in the area of economic policy making is that pandemic risk is not an economic development concern. And this is just wrong, because it's a very high return investment. So having high returns is good for development. And if you don't do it, then there are costs that that we are seeing now. And the robust public health systems, both veterinary and human and environmental, can collaborate to detect contagion early, respond rapidly, and help stop it. And this is a highly profitable undertaking. I mean, there's no better investment in the public sector anywhere than this. And these same systems also prevent control of endemic zoonoses that are very among the neglected diseases, and they are very poverty inducing. Okay, so sorry, this is, I don't know why this window is, sorry. So this, okay, so I want to explain something about the neglected the World Bank, the way it actually works, because if we begin to understand it, then we can think of ways of avoiding it in the future. So in 2006, there was the response to H5N1, and there was a big mobilization of funds for, from the World Bank, they went to 60 countries, and it was 1.3 billion. And it was a very sort of dynamic, rapid program of building capacity to detect, diagnose, and control outbreaks. And most of these countries start from a very low base. So, what was accomplished is by far not complete, okay? And there was a large $4 billion global program led by launched by President Bush and very much led by the United States and the European Union. So there was a lot of political enthusiasm. And so then there were assessments and of the core capacities in more than 30 countries. And they resulted in the national integrated action plans that would, finance the capacity so they would improve. And this also was done for Guinea, Liberia, and Sierra Leone. And these plans were shelved. The World Bank ignored them. They didn't finance any of these action plans, and nobody else did much either. So, countries were as unprepared as they were before the action plans. There was no action. Nevertheless, in 2010, the World Bank and the UN, David Nabarro, UNSIC, published a framework for sustaining momentum to keep building these capacities to control pandemic risk. And within 2 years, the World Bank dismantled the program, 9 years ahead of the formal closing date. In the next 2 years, the World Bank management declined country requests for follow-on projects on preparedness, for One Health preparedness projects. Then in the same year, the health sector management requested excluding health emergencies from the IDA crisis response mechanism. It's called crisis response window. This is the standard sort of rapid response financing the bank has, but the health sector management decided they didn't want to be part of it. And then the same year, they deleted pandemics brief from annual meetings over objections from the UK Cabinet Office. Then next year, there was a report, The Economics of One Health, which became quite useful in this area. And it was buried by health sector management until 2013 because they saw it as competition to the universal health coverage agenda. In 2012, the management spokesman articulated the pandemic strategy as, what do you want? To scare people? Like meaning, we are not doing pandemics. And this is in the World Bank, okay? So this is very worrisome. In 2013, there was a desktop simulation to MERS, of response to MERS, and it was abandoned after like 3 days because nobody was interested. Then 2013, Ebola outbreaks begins in West Africa. In April 2014, there's a high-level event at the World Bank with about 300 people, all the senior people in global health, UN Secretary General, ministers, and Ebola was not mentioned at this 2-day event. And when Bloomberg and Summers on a panel mentioned pandemic risk, the organizers were shocked. Okay. Anyway, so it goes, nothing happens, then Ebola turns out to be a disaster. And instead of, reinforcing the preparedness work, the World Bank announced a $20 billion pandemic fund, which would be funded by pandemic bonds. So it was very sort of exotic. And this served as, it was only for sort of response and not preparedness. And it was mischaracterized in a serious way. And basically it served as a fig leaf for neglect because the World Bank could point to, oh, we are doing pandemic bonds. So we have done pandemics. So don't bother us with anything else. So this is what it looks like even 2 years later until this year. We have a real COVID pandemic, and the developing countries are going to have excess deaths and higher economic costs because basically 10 years had been wasted in an international organization and nobody is accountable. So how do we avoid this in the future? That's the challenge. And if somebody, I mean, this is just some ideas that G20 could take the leadership and set a goal so that all the institutions would, World Bank and others, WHO, OIE could work towards a goal if they knew what the goal is. I mean, the goal of compliance with IHR is like, has never been really announced. But, this maybe with COVID, this can be taken seriously so that these systems begin to be systematically built. This would be managed by OIE and WHO oversight. There's a preparedness monitoring board. With some support, this system could work and close the gaps. Now, governments should be accountable for implementation, which is the case now. But many governments say, well, we don't have money. But in the what could be done going forward is that the World Bank and other banks would be responsible for closing the financing gaps. I mean, why do we have the World Bank and other such institutions if not to finance the most important expenditures globally? So the MDBs should be responsible for responding positively to any requests, and it should be monitored because otherwise, things will happen under the radar. And in IDA, which is the concessional fund, which is it's relatively scarce money. It's a large fund. It's like $80 billion now for 3 years. So there's plenty of money. It's just not adequately prioritized. So the financing for these core public health systems, which have a very modest cost, as we saw a couple of slides ago, should be treated as additional to what the country gets in any case, so that they would have more of an incentive. This worked like a dream for regional allocations when the international community decided that regional integration should be promoted. The World Bank was allocating for regional projects sort of over and above the country allocations, and all of a sudden there were dozens and dozens of regional projects. Okay, so that's the incentive. And so we can sharpen focus on effectiveness of global health financing. And here the important distinction is between this core financing and now it went away. No, and supportive financing. And most of global health programs are of this supportive character. What's core is really only the global public goods in the sort of strict sense, meaning epidemic prevention and control, issues like AMR, compliance with international health regulations, but nothing else. And this is relatively small amount of money, but it has to be much better monitored, and it has to be reported on, because otherwise the international organizations will not necessarily carry out this mandate if nobody's watching, which that's the experience of the last decade. I think nobody was watching, and now we are paying. So since these myths, the oversight and coordination should not be in the health sector, I think this is so important. I mean, we have failed because within the health sector, it's very difficult to allocate resources rationally. There's always a need for more. There are always people who are sick now and who have diseases that cost a lot of money to treat. And so those funds are always going to get channeled to the medical side of the health sector. And the public health side has been starved for attention and funds, pretty much everywhere. And then IMF and World Bank, since the economic impact is so immense, and finally, it should be clear even to the economists that pandemics have macroeconomic impacts, then they should be required to include it in their standard assessments of adequacy of policies to manage economic risks. Because, you know, if the IMF comes to a country and says, like, you know, how much are you spending on your CDC or equivalent institution, it carries a different weight than if the WHO asks the same question, right? And the IMF would rely on WHO assessment on whether it's adequate or not, but it's important that the economic institutions start to asking these questions, because otherwise it's going to be neglected again. And World Bank financing, which is, you know, quite substantial in the health sector, I think it's more than $1 billion a year, should be conditional on adequate progress toward core public health systems. And so, thank you.
All right, thank you so much. Both wonderful presentations. And since we are a little bit closer to the end of the time, I think I'm going to focus mostly on doing some of the audience questions that we got here. And we actually had several questions. So I'm gonna say either of you who wants to answer this, or both of you, getting both of your perspectives would be good. But we had several questions that were asked about the transition in leadership in the United States and how that might impact international collaboration going forward, or what you kind of expect to see or hope to see as the administrations change over. So there was a lot of that. That was my summarized version of many people's questions. So, Olga, would you like to start?
Sure. I mean, I think that you know, it's excellent, because withdrawing from WHO in the middle of a pandemic was like, you know, it was completely surreal to hear something like that. So there is a need for, I mean, these institutions, these international organizations serve a purpose of, you know, helping countries work with each other, like through the organizations, they mediate it. And if you don't have these organizations, then you are going to, you know, have inconsistent policies, and it's just, the situation is not going to be handled as well as if you coordinate. So if this, yeah, I believe President-elect Biden has announced that he will rejoin and you know, increase financing for WHO, and that's very justified.
So, yeah, Christy, just to add, you know, when you're in a place like Geneva or one of the organizations with an international membership, there typically is a change in the language by the US spokesperson depending on the administration. And so, for example, you can very directly look at language on things like maternal child health, the environment, and so on. And this has happened, you know, happens over and over again when there's a change in administration. So in a certain sense, with the new administration coming in, we can expect that change. But there is going to be, you know, the difference of going from the Trump administration to the Biden administration is going to be very large. One of the things that we can expect to see is that the language and discussions will be more normalized. However, I think the other thing is that there is now a great deal of uncertainties as to other countries, excuse me, other countries in terms of what they might expect from the US. And so I expect that the US positions are going to get challenged more than they would have been in the past. And I think that these initial challenges are how the current the new spokespersons in a place like Geneva, or, you know, for that matter, other fora, address those issues is really going to go a long ways towards other countries' establishment of how much and where they can depend on the US. And to be blunt, these challenges and these doubts are going to come both from allies as well as from countries that see themselves as competitors to the US.
All right, thank you very much. I think one of the other big questions that a lot of our audience members had was about vaccine. When we do have a vaccine, when we get to the point where we do have a vaccine that's approved and manufactured, how important is international cooperation and collaboration to vaccine distribution? And what do you see as some of the potential challenges? And also, can the development and distribution of this vaccine be a way to build international trust back up in the community, in the international community?
Olga, do you want to go first? Want me to go first?
No, well, I mean, I think, you know, it's a real problem when you have sort of political borders around a problem that does not have borders. And so if you have the vaccine, you should be vaccinating where it makes sense to, you know, stop the contagion the most. For example, you know, health workers, right? I mean, they should be a priority whether they live in the United States or whether they live in Congo or Tanzania, because they are going to, you know, just by the nature of their work and exposure, they are at greater risk, and they can sort of amplify contagion and make the situation worse for everyone potentially, right? I mean, it doesn't know any borders. So hopefully there will be, I think for H1N1, there was an attempt to allocate 10% of sort of unused vaccines from rich countries to priority uses in poor countries. And it kind of worked, but it, you know, took a long time. And it was a very sort of small amount. So hopefully this time around it will be more ambitious, but I don't know if they are the same. I mean, it's going to be more difficult to deliver this vaccine in low-income countries if it has to be at minus 80 degrees or something. It's, you know, it's just going to be technically more you know, impossible if you don't have the infrastructure for it, for the delivery. But this is being worked on. I don't know, Keiji, you probably know much more about the prospects for a better system of distributing vaccines.
Well, you know, I think our previous or much of our emergency vaccine related experience comes from influenza, but there's some big difference between influenza and COVID. As Olga mentioned, one of the frameworks, the pandemic influenza framework, which took about 5 years to negotiate, has as part of that, the private sector had agreed to donate about 10% of its output, whether it's antiviral drugs or vaccines, to WHO for distribution to countries that don't have vaccine as the quid pro quo for receiving information from WHO and support. And so kind of a system for sharing vaccine. And this came out of the experience of the H1N1 pandemic and other situations in which it was very hard to negotiate how countries that had vaccines might share vaccines with other countries. In the COVID situation, we don't have such a framework. And we also have a much larger group of companies and countries actively trying to develop and provide vaccine. And right now, you know, we've heard things such as good news from Pfizer and so on potentially on how it performs, but there's still a number of questions. But in terms of opportunities and challenges, it's an enormous challenge. Let me be blunt there, because countries are all going to have to weigh the extent to which they need to hold on to vaccine to protect their own populations if they have vaccine, and the extent to which they're willing to share vaccines with others and so on. So this is going to be watched very carefully. The second thing is that I think this is unfortunately going to be part of the geopolitical struggle. And so there is a sense that vaccine is also going to be a way in which a country establishes the degree to which it is cooperative or open to the rest of the world, and so on. And I think it's going to be partly interpreted in that way. And so the extent to which vaccine producing countries do work with the private sector to make sure that vaccine can go to the countries that don't have it, I think that is going to be watched very carefully in terms of the countries that don't have it. And I think it goes back to the previous question about the change in administration. I think this is one of the opportunities for the US to show that it does have a different philosophy and a different approach than the previous or current administration, but that remains to be seen.
Right, yeah, there's a lot of big challenges. I think a lot of times we forget that there are all these challenges after the vaccine is approved that we still have to think about. Kind of building on that, we had a question that said, to what extent are international or intellectual property related issues a barrier for international cooperation? So, you know, some of the issues between the United States and China, and we had the cybersecurity instances, hacking instances recently. So could you guys speak to that a little bit? You're muted, Olga.
Keiji, go ahead. I mean, the only issue I am vaguely aware of is the controversy around the virus, you know, sample from H5N1, which caused quite a stir for at least 5 years, I think, with, you know, Indonesia claiming that you know, they could own the virus somehow, although it could, you know, get on a bird and fly to Singapore at any time. But I think that has been settled in some way now as a problem. And
yeah, no, I think there are, again, what Olga had mentioned has to do with the pandemic influenza preparedness framework. Again, we have struggled mightily with intellectual property issues as being a challenge to international cooperation. And so again, at the heart of the pandemic influenza preparedness framework was the issue that some countries did not want to share H5N1 viruses. Again, one of the previous and still contemporary threats with other countries and with WHO, because it felt that it was not gaining any benefit from sharing. And intellectual property was one of the issues, but also the outcomes of working with viruses, such as diagnostic tests, vaccines, potentially medicines, were not going to be made available. And so this has been a major problem. And I think that it continues to be an issue about sharing viruses. You know, we have problems sharing viruses, again, to make it a little bit simple, but we have problems sharing viruses often because we have worries about whether someone is going to take that and produce some kind of device or invention which can be patented. And this has gotten to be a little bit more difficult because information is now, in terms of viral genomes and so on, is being shared more quickly than ever before. But the other way in which intellectual property considerations has been a problem in the past and continues to be is that oftentimes information is not released until there's a peer-reviewed publication. And so at the level of individuals, this can be slower than is desirable. Again, we have some mechanisms and things have changed. You know, we have pre-published manuscripts which are now put up more quickly. And I think in many ways, scientists are much more cooperative than in the past in terms of sharing information. So there are vast discussions going on electronically, which we hadn't really seen to this extent before. And so in a certain way, I would say that the IP issues remain as a major issue, but it is very interesting. I think that we are beginning to find some ways to get around them.
All right, thank you. I'm going to switch gears really quick with this next question, and this is directed to Olga. So in the United States, but in other places, there kind of emerged this theme that there was this dichotomy, that it was either the economy or a public health response. So I was just wondering, you know, how would you respond to that, and how in the future can we kind of avoid that idea that it's the economy or health?
Well, you know, I mean, clearly, the public health situation has to be under control, or the economy is going to be in trouble, as it is in most of the world now. Because if people are afraid and they are receiving false information from their authorities, which unfortunately has been frequent in many countries, then the economy is going to suffer, whether or not there are public health measures as such, these lockdowns and restrictions on what's open, and people are just going to be concerned about their health, and so that's without the public health risks being diminished, the economy cannot really recover in any sustained way. So I know it invites a lot of sort of hyperbolic statements about saving lives or saving jobs, right? I mean, people put them opposite each other, but they really have to work together, which comes back to this idea of the response to a pandemic has to be multi-sectoral. I mean, it cannot be just the health sector issuing edicts. I mean, they have to talk to the commerce minister and the finance minister, because it's really the society, the way people behave, that spreads the virus. It's not just the sort of the medical problem, or people being ill and crowding into hospitals. I mean, that's definitely important, right? But it's important to also take into account the other impacts. I think the story now about like the COVID impact in Africa is that it's largely due to the economic impact. There is no virus, at least it's not detected, and I mean, it's not noticeable in the way diseases are tracked there, which is not very well. But anyway, the rising poverty across Africa and maybe other developing countries is because of the sharp economic decline that the whole world is experiencing and that they are experiencing. And they are, the tourism-dependent countries, which many of these countries are actually the poorest countries in the world, that have a high share of tourism. That sector has plummeted, and the poverty of the people that depend on it is increasing sharply. So you cannot just say it's a public health response. They have to go together, because that's such a sort of vexing problem about pandemics is that it's very complex. It's a behavior of people as consumers, as producers, employees, and also as agents of spreading contagion. So it has to be ideally a response like that has to be directed from, say, in the US context, from the White House, right? And I think that was the case before, right? There was a position in National Security Council, I think, that was abolished by Trump, but the sort of multi-sectoral authority like the president or prime minister, minister of development would be an appropriate sort of coordinator. You need more than just public health.
And since we are, Keiji, did you want to add anything, or I was going to go on to the next question?
Well, just to reinforce a point by Olga, it's a false dichotomy. I mean, of course, you have to balance both. It's really a matter of balancing, and it just brings up the whole point of why acting early as a country is so important. It is much, much easier to deal with these sort of situations when the outbreak itself is smaller. You know, in Hong Kong, every time the advisory panel meets with the government, of course, this issue of where to balance health considerations and economic considerations imbues all of the discussions. It's a very real concern for all of us, but it is much easier to deal with when the numbers are smaller. That's part of the difficulty now for many countries. And but you make it a dichotomy if you want to really basically create gridlock, because it's an unrealistic question. Is it one or the other? You know, it's only, you know, it can only be both.
Right. And so this will be our last question, and I'm sorry to everyone who did not get around to your questions. We had a lot of really great questions, but this is kind of a broad question. So I wanted or a broad and important question. So I wanted to wrap up with this. And the question is, what are we missing in predicting the next crisis? And I guess we can also take that as, what are the lessons that we really need to learn from COVID-19 as we prepare for what will be the next pandemic, whatever that is. Keiji, would you like to start?
Yeah, well, to put out a couple of thoughts, I think that the idea of predicting is not a useful idea. I mean, we spend a lot of time talking about predicting. Can we predict the emergence of a virus in a location? Can we look at different factors? And there are, you know, there's important work going on in this respect. You know, one of the reasons why so much attention has been highlighted on the laboratory in Wuhan is because they are quite active in the search for looking for what are potential pandemic viruses which are going to occur in the future. And I completely think that this is an important line of investigation. It's been estimated that we know about 5% of the viruses out there, and there are many others. But even if we identify the other 95% of viruses out there, prediction is still a completely different matter. So I think it's useful to continue in that. But I think the real question is not what is missing in our ability to predict, but what is missing in terms of our being as situated and positioned as well off as possible when the next pandemic occurs or the next challenge occurs. And when I step back far enough, I see the challenges of a pandemic similar to the challenges of climate change, similar to the challenges of antimicrobial resistance, and so on. They differ in important respects, but the big characteristics that all of these are societal issues, they're political issues, they are cultural issues, and so on. And so for me, I think the lesson of COVID is that if we are going to deal with issues arising in the modern world, which is highly interlinked, in which economies are very dependent upon each other, but in which it is now clear that we can create a huge amount of confusion and gridlock very quickly, that the lesson from COVID is that we need to pay attention to where we are having problems. And you know, in the slides that I presented, I said that I thought that many of the key issues that we need to look at are quite simple questions like, why has science become questioned? Why do so many people think that the pandemic is fake? Why are people really very hostile to the other perspective, and so on? We have these very practical questions which are before us. Unless we answer those and find ways to resolve those kinds of issues, I think we're going to find it very difficult to deal with any other complex challenge coming down the line. You know, in the same way that we have people talking about climate change being not real. You know, it's a little bit hard for me to understand how people can have that perspective, but some people do have that perspective. And it's not going to be helpful unless we shift the discussion over to, we have a difficult situation. How do we put our systems, our resources, our thinking together and to deal with that situation? But right now, we are simply stuck in many respects as to even questioning whether we have a situation or not. And this is terrifically dysfunctional. So for me, that is, I think, the overarching point coming out of COVID that we ought to take stock of. We have to become functional. Then we can deal with these issues. We can deal with climate change. We can deal with pandemics if we are functional.
Olga, did you have anything to add before we wrap up?
Yeah, I think the sort of the heart of the dysfunction is the lack of accountability for these systems being in place and functioning as they, you know, as defenses. And unless we establish some way to have the relevant managers and institutions accountable for the choices they make, because the people making these choices know perfectly well that they are making the wrong choice, right? I mean, they are well educated and they have sort of heard about prevention being better than the cure, etc., right? And yet at the same time, they treat prevention as a joke, and because they can get away with it, right? So there's no accountability for doing the right thing. And if this can be solved, then I think we'll be much better off.
All right. Well, thank you both very much. This was a fantastic discussion, and myself and I'm sure the audience appreciates your time here and your wonderful talk. So thank you, and thank you to everyone for being here. I hope you attend another Scowcroft event in the future.
Thank you, Christy.
Thank you, Christy. See you, Olga.
Bye.